Women make up 70% of the healthcare workforce, but only 20% of its leadership. On Her Story, we'll explore the careers of bold and influential women from Silicon Valley to Capitol Hill and learn how they've overcome the odds. This is Her Story, a program where we explore what's beyond the glass ceiling.
Welcome to our next episode of Her Story. And I'm absolutely delighted today to be conducting an interview with Leslie Norwalk, who is an amazing woman, an amazing leader, and a really good friend. So Leslie, welcome to Her Story.
Thank you. It's a pleasure to be here with you today.
I wanted to introduce you to our audience just by saying that in addition to being an attorney, Leslie served as the deputy administrator of CMS for a number of years, and then the acting administrator of CMS for a period of time after that, before she moved on to her current role in the external environment. So we're going to really dig deep into the CMS journey, because for those who aren't familiar with CMS, it is the second largest piece of our federal government spend and an enormous responsibility. So Leslie, I'd like to go back in time and start with your childhood and how you ended up dreaming when you were a little girl of becoming the CMS administrator.
Well, funny enough, when I was a little girl, I did dream of being a CEO and on the cover of, say, Forbes magazine, which perhaps was a bit different from my peers who were thinking about 17 or Glamour or whatever it was at the time. But I can assure you that I had no idea that Medicare existed or the difference between Medicare and Medicaid. And if you'd said HCFA, which was the predecessor to CMS, or CMS, I probably would have looked at you with a puzzled look on my face for sure. In fact, I think I didn't really become interested in the government or public policy until after college, when I moved to Washington, D.C. So early on, not so much in my thought process, but it's funny how sometimes you just take what comes with life, and it's wonderful where you end up.
Well, you did end up in law school, so that must have been a process. How did that happen?
Well, so after I graduated from college, I had really wanted to be an investment banker, although I question now why that was. But it seemed to be the thing to do when I was in college. It didn't happen. The stock market crashed my senior year, and I moved to Washington, D.C. after graduation. And I ended up working on the George H.W. Bush campaign. And when I was on that campaign, I became interested in government and how those things work, not surprisingly. And after he was elected, I found myself working in the White House, which was super exciting. And when I left that position in presidential personnel, I went to work for the U.S. Trade Representative, one of the deputies there. And they negotiate all the trade agreements with foreign countries. But frankly, I was a little bored. So I decided I would go to law school at night. And that's how I ended up in law school. So I started and went to school at night for the end of the Bush administration, and found myself at a law firm doing healthcare law while I was in law school. I was a paralegal and a law clerk, and that's how I found myself in the healthcare sector. That
was going to be my next question, because there's a bit of a gap between investment banker and U.S. trade representation to CMS.
There's no doubt that's true. And it's very funny, because when I was in college, I majored in international relations and economics. And the part of that reasoning was I didn't want to major in politics, because I didn't think that domestic policy was all that interesting. So I find it very ironic that when I left college and didn't get my dream job, it turns out that when you have lemons, you make lemonade. And it turns out that I ended up with a really fantastic opportunity working in the Bush administration. And the reason I ended up in healthcare was because the only law firm job I could find when I graduated happened to be where I am currently, Epstein Becker Green, and they have a very large healthcare practice. And that's the sort of law I ended up practicing. So it's funny. I would say it's an interesting lesson. Sometimes you have great hopes and dreams to do something, and something entirely different happens, and don't lose faith because.
Well, actually, I would say our nation is lucky that you ended up where you did, because you served at CMS under an incredibly pivotal period of time in our history of health services. And that's how I knew you, because I was in the administration at the same time at CDC. And we spent a few times on buses and airplanes traveling around the country explaining to people the importance of Medicare Part D. So talk a little bit about that, because I'm not sure everyone remembers that was a heavy lift, and you had a big part in making that happen.
Thank you. Yeah, so once upon a time, it's hard to imagine that our nation's largest health insurer, the Medicare program, didn't offer prescription drug coverage. So if you needed a drug that you would pick up at the drugstore that was prescribed by your physician, Medicare didn't cover that until 2006. And when I was at CMS in 2003, that became law. So which is to say the Congress passed the Medicare Modernization Act, which created the Medicare Part D, or the drug benefit program for Medicare beneficiaries. And we had the very arduous task of implementing a brand new program that many people were quite skeptical would ever succeed. And frankly, we weren't sure it was going to succeed either. So, and once we implemented it, we had to get people interested and convince Medicare beneficiaries it was worth it to sign up for it, where you and I got to spend lots of time together. It was really a true privilege and pleasure to be able to travel the country with you and our other HHS colleagues, teaching them about the Medicare drug benefit. It was really terrific.
So when you look back on it now, we had aspirations for what Medicare Part D could provide for people. Do you feel like it was successful?
Oh, it was tremendously successful. I think it was such an important effort to incorporate everyone we could find to help get it off the ground. I think that between the private sector and the Medicare Advantage plans, which are the HMO plans that help Medicare beneficiaries, or the standalone prescription drug plans, those insurance companies and the pharmaceutical benefit managers, all the pharmacies and the drug manufacturers, the entire private industry around the drug benefit came together with the government in order to make it successful. And I define success in several different ways. One is how many beneficiaries signed up for the program. And over time, it's continued to grow, which is terrific. We've also kept the cost well below what it was originally expected to cost when Congress passed the law in 2003. Premiums have been lower than expected. Even today, I think many beneficiaries have the ability to sign up for a drug plan at very little, if any, premium, which is really fantastic because it's prescription drug treatment is such an important part of healthcare today. It's crazy to think that the Medicare program didn't have it until 2006. But between the cost and the access and the drugs that beneficiaries are able to succeed or to receive, I think we've been really, really lucky in the success that it's had. And administration after administration, it used to be quite political. And now I think, particularly with the latest iteration of the Inflation Reduction Act that passed this year, more and more beneficiaries will see enhanced coverage. So it continues to improve for beneficiaries, and the cost is still quite reasonable, I think, for what they get.
When you think about the tremendous improvement in access to medicines that's created for Medicare, it's hard to imagine that very many things compare in overall health impact in the United States, especially for vulnerable seniors. But I know that, well, first of all, it's not surprising that you became the acting administrator of CMS following on the implementation success. But as you said, at the time, there was a lot of controversy around this. And I know you had to testify in Congress a lot. How did you cope with that? Maybe not as contentious as it is today, but nevertheless, you were in the hot seat.
I was in the hot seat. It's an interesting thing, politics. For for whatever reason, by the time I became the acting administrator, the Democrats, so I worked for George W. Bush when we implemented the drug benefits. So at the time I was there, the Republicans had just been voted out of the House, and the Democrats were leading the House at the time. And those individuals, those members of Congress, were rather anxious to hear people in the administration testify about programs. Perhaps they didn't have quite as much information as they would have wanted to have from years prior. So frequently I was asked to come and testify before Congress and varying committees about different parts of the Medicare program, the drug benefit being just one. And I think that in order to do that type of activity successfully, you have to be very straightforward and answer questions as truthfully as you know, and be as informational as possible and try not to be political. At least that would be my advice for people testifying, and have a good sense of how to explain, if you can, a program that tends to be quite complicated, but do it in a way that even if a questioner happens to be a little bit hostile, perhaps appreciate your audience is broader than just the person who's asking the question, so that you can provide information broadly and hopefully stay out of trouble in the process.
Not an easy task. I kind of know that firsthand, but
I'm sure
you were amazing. I mean, the complexities of any of the CMS policies are hard to explain, even if you're an expert. So it was a really important part of socializing the value of the program and keeping it rolling as administrations changed. We both served under pretty incredible secretaries, Secretary Thompson and Secretary Leavitt, very effective leaders. Both had been governors for a long period of time and really knew how to achieve consensus and drive complex programs forward. But sometimes it did feel a little lonely from the gender perspective. So how did you cope with that, both inside of CMS, but also in the complexities of HHS?
I think it's not dissimilar to how I thought about testifying before Congress. I think as a general rule, I try to ignore the fact that there are gender differences, but appreciating that they exist. Try and always know more than anyone else in the room about my subjects, and try and present things in a way that that anyone can understand them, because as you said, they're quite complex. And always be prepared. Don't be afraid to speak up when it's required and when it's your turn, if you will. But and sometimes you have to be a little more elbows out than your male counterparts, but to try and do it in a way that is productive as opposed to maybe interrupting or whatnot. And the other thing that I would say, and this is, I think, a good lesson even today, is to be sure to give credit to your colleagues where credit is due. And sometimes it's helpful to find others to amplify your message or to bring your message to the table if you think you're not going to be heard. So sometimes I would talk to others in advance of meetings and talk to them about the position that CMS was taking and hope that they could help us tell the CMS story. And I found that to be very effective.
That's a great tip, really great tip. We talked a little bit recently about your mom, and I think you described her as a powerhouse.
Indeed, she was.
What kind of an effect did that have on your ability to handle these kinds of situations?
It's very funny. I would say several things. When I was growing up, I can remember at one point in time, I was probably in high school or maybe in college, I asked her about gender discrimination because I grew up in a household where she was the main breadwinner. And I like to think of her as always large and in charge. And so literally. And so she did tell me that gender discrimination existed. And I remember being a bit surprised by it because it was just not something that I saw much of, certainly not in my household. So I think that in a part definitely helped. And there's no question that I inherited a fair amount of her strength, and not being embarrassed or afraid to speak up when need be. She tragically passed away when I was in my mid-20s. And I think that at the end of the day, what doesn't kill you makes you stronger. And that was a very difficult time for me after she died. And now when I look back, I think I would rather emulate her strength. And I think a lot of that comes from either having gone through that hardship, but also having had the blessing of learning from her, throughout my childhood and early adulthood.
So now you're an aunt.
I am.
And you, I know, take a very active role in being an aunt for your nieces. But that's not the only mentoring you do. And you've probably been asked by lots of people to be a mentor. But I know even perhaps more important than that is your sponsorship of other professional women and men who are on the rise. So let's talk a little bit about that concept of sponsorship, because it sometimes gets overlooked in the conversation about career development.
Yeah, I think sponsorship may be as important, if not more important, than mentorship, particularly as you and I both have a fairly busy life, and I play many different roles. So it is often difficult for me because I don't have people with whom I spend lots of time on a day-to-day basis, because I sit on lots of boards of directors. So the roles that I play are quite disparate. And particularly because of that, it is probably a little bit harder for me to mentor on a regular basis. But I have met some of the most spectacular people, men and women alike, and helping them get a start to, or perhaps a change if they're changing their career, to help them figure out what it's like to transition to something that's more full-time, to a role where you're serving on boards in particular. And when you find wonderful people, to sponsor them and to help them, maybe that's more mentorship, but to help them in a way figure out the ins and outs of board service and how and why to join a board, how to look for board seats, et cetera, and then helping sponsor them once they get there. So introducing them to people and so forth. It's really a privilege. And I have to say, one of the most fun things about life after CMS is that I have met the most spectacular people. It's really a privilege.
So when someone asks you, should I join a board, or why would I join a board? What's your answer?
Well, absolutely. That's not to say that one shouldn't be picky, because not all boards are created equal. Every group of people has a very different personality, and how they function is different. So first, for me, at least, I think it's really important to be with a group of people where you respect each other and can engage in honest and direct conversation to whatever end it is that the organization is hoping to meet. So I think that is really important, to find the right group of people. But that said, certainly been one of the highlights of the last 10, 15 years of my life is being able to serve with lots of really terrific people, very smart, different interests, different strengths, and really helping an organization move to the next level. It's quite a privilege.
I've watched your board career from a distance with admiration, because I see the fascinating companies that you've been involved with and the kinds of businesses that they're in, and the healthcare associated, but nevertheless pretty broad. So you, I'm sure, are having a significant impact on the boards, but also on some of these young companies and in their direction, but also their impact. Do you feel like you get back from that? You're giving a lot, but what do you get back? Maybe that's a better way to ask the question.
Yeah, no, absolutely. It's really terrific to be able to help companies that are looking to try and solve a whole myriad of healthcare problems. heaven knows we have no shortage of them. And helping companies figure out how to get reimbursed from the Medicare program, making sure that they do things in a compliant manner, and helping them not trip up on things that I have seen go wrong in other companies. At least that's the hope. That's easy enough to put that in. But in terms of what you get back is fellowship with people that you may never have met otherwise, who have really, I've really found my life enriched by their experiences. I learned so much from my fellow board members, from whether it's their financial acumen or how they've managed other businesses, or frankly, things on the fun side, travel, or other experiences that they've had that I think, wow, I'm really going to need to try that next time I take a vacation. That sounds fantastic. I think, yeah, those are the sorts of things in terms of getting back that, you just, personal relationships are everything.
Many women at earlier stages of their careers struggle to get on their first board. The first board may not be a corporate board or a established business board. It may be something in your community or something that just gives you your foot in the door to meet that network and find those people who can sponsor you and recognize your capacity to contribute. What was your very first board?
That's an excellent question. Boy, I have to really go back and think of which one it was. It might have been Broad Lane, which was a group purchasing organization that had originally been spun out of Tenet Hospital.
And how did you do it? Do you remember how you got your foot in the door for the first time?
I do, and it's much to your point about sponsorship. I had met several people in the private equity space when I was giving speeches at CMS. And one individual in particular was at a private equity fund that owned this GPO, or group purchasing organization. And he was very interested in getting me involved in some capacity, whether it was a board capacity or if I would be CEO of one of their companies. And I, at the time, had enough of managing people, because as you well know, it can be very exhausting. So I wasn't really ready to manage people. So that's one of the ways that I ended up there. I think there were a couple of other private equity fund boards that I joined around that same time. I can't remember which one came first, but a lot of it was, frankly, someone sponsored me, if you will, introduced me to other people. And that was how I ended up on probably 2 or 3 boards at that point in time in the healthcare spaces. Again, really fortunate to have met them. Some through CMS, some through my law firm. But again, your earlier question about sponsorship is how I got started.
I'm listening to this and thinking about all of the things that you're involved in, and I'm curious, and I'm sure our audience is curious, how do you restore yourself? What are your life-sustaining efforts independent of your professional activities?
Super important to have them. I think on a day-to-day basis, I try to keep my body in shape by doing Pilates. So I do Pilates, most days. I like to play tennis because it's one thing that clears my mind entirely. And I try to do that most days as well, although sometimes my body doesn't agree with what I'd like to do. But when I really need to get away, and this is something that you and I are very fortunate to have in common, there's very little as life-sustaining and refreshing as going on safari. I don't know if you can see my leopard photograph behind me, probably coming out of the tree to take my head off. But there's nothing like spending time in the bush in Africa, remembering that the world is bigger than you are, and reconnecting with the earth and with animals, and refreshing and clearing your mind entirely, and coming back being able to be renewed and reinvigorated. To me, that's quite life-sustaining.
So when you talk to your nieces about their growing up and what they might aspire to in the world, what advice do you give them?
I think one of the most important traits that has helped me succeed is curiosity. And there's several traits, but curiosity has really been the lifeblood of what I like to do. One of the reasons I loved working at CMS, and I continue to enjoy work in the Medicare field in particular, is that it's incredibly complex. And it requires a lot of research to keep up with all the varying changes around Medicare payment rules and so forth. And because I'm so curious, I do research all the time about what's going on. And I've always loved to research. Even with COVID, I spent a lot of time reading randomized clinical trials on what would be the most effective vaccine and why and what combination and so forth. And I think that being curious allows me to deal with all sorts of problems, whether they be work-related or otherwise, because I'm not afraid to research the solution. Of course, the internet has totally changed. When I was growing up, we didn't have that. So my first admonition to them is, continue to be curious. That's the first thing. And the second is, treat people as you'd like to be treated. I think those are two important things. And then thirdly, who you are is not what you do. Those are probably my three things. And then maybe fourth, maybe I have many apparently. If you look in the most important person, who's the most important opinion is your own. So looking in the mirror and being comfortable with what you see looking back at you is really, really important, because as I'm sure you know as well as I do, going through life, there'll be a lot of people who want to knock you down. And a lot of people will say things that might not be kind. And some people, fair enough, if they're your friends and family, you need to listen to them. But there's a whole lot of extraneous noise, and you don't have to hear it all. You don't always have to pay attention to what everyone is saying, but you do have to be comfortable in your own skin.
Well, Leslie, this interview has gone incredibly fast, too fast, because I think we could continue this conversation indefinitely. But I am, first of all, thanking you from the bottom of my heart for making time for this. But also, I really want to say that I have no doubt in my mind and in my heart that when you look in the mirror, you can be both proud of who you are, but also what you do. And we're very fortunate that some of your accomplishments have touched everyone in our family and beyond. So thank you so much for
You're both kind. Thank you.
being here. Thank you.
Such a pleasure.